In the summer of 1994, our state experienced its worst wildfires in 65 years. The Washington National Guard reacted quickly to a request for help from the Department of Natural Resources, or DNR, with Firestorm 94. The Emergency Operations Center was put into service on July 27th. They immediately started around-the-clock operations and requested volunteers. Army and Air National Guard units were notified to stand by. Soldiers and airmen worked as support personnel for civilian firefighters. Later, as the fire spread, the involvement of the Washington National Guard grew. Governor Lowry ordered the militia into state active service. Soldiers were activated and received 2.5 days of military firefighting instruction from DNR at Yakima Training Center. After completing the training, guardsmen deploy to a base camp where they receive a briefing on their mission. While fires burn on the ground, aircraft fly above, performing essential aviation missions. Air support, such as a daily parts run, was provided by various aircraft from the 66th Aviation Brigade. Once the missions were complete, our soldiers convoyed to Yakima Training Center to begin demob, or the demobilization process. Demob is the official process of returning soldiers to civilian status. United States military personnel travel the globe providing specialized services to people in need. This is great training and a great public service. Washington National Guard medical units are no strangers to humanitarian missions, and now soldiers and airmen have an opportunity to get low-cost, real-world training while putting something back into local communities. Deputy Secretary and Health Officer for the Department of Health, Dr. Mimi Fields, explains how these communities are identified.
The intent of the Guard Care program was really to reach people who are in great need in underserved areas.
Health agencies work with the Guard Care Coordinator to schedule events. Time frames for mobilization and the amount of effort required in terms of resources and personnel are identified. Another 1994 Guard Care event took place at this small clinic in Pacific County. Kathy Spoor, Director of Pacific County Health and Human Services, talks about the important role the Guard Care program played in her community.
Finding dental care for these kids has been a real challenge for the community. We have about 7,000 people here in North Pacific County, and we currently have 2 dentists. Both are semi-retired, aren't accepting new patients, don't accept medical coupons for payment. And so it's real difficult to find care that is local, that is easily accessible to these families. Many of them have trouble with transportation and are low-income families. So it's been a real challenge for us. We used to provide this service through the health department, but our capacity is limited now. So this has worked out great to work together with the National Guard and provide that care.
Guard Care Coordinator, Sergeant First Class Ken Wolf, explains.
The Guard Care program allows unit commanders to exercise what I would call a full mission profile.
The value of this program to the National Guard can be gauged in the training objectives accomplished, as well as other less tangible benefits.
It isn't something that we have emphasized as much, but it is truly a part of the Guard spirit, is training to think in terms of collaboration. The target is to help people that have a need for better care, for better medical care. And I can't think of anyone that wouldn't be rewarded by that sense of collaboration and that sense of partnership that Guard Care just so beautifully brings together for all of us.
Caught between a rock and a hard place. That's where soldiers and civilians could find themselves when they pass by or enter the Yakima Armory. You'd expect obvious visible problems in a building of this age, such as water damage and settling floors, but it's the structural integrity of the armory that is the cause for concern. So, in the event of a tornado watch or sustained earthquakes, what will those who sought safety within the armory's walls find? Mark D'Amato, an independent consulting engineer, visited the armory to give a seismic stability evaluation.
One of the things that the seismic evaluation points out is the gross weakness of the mortar of the masonry. As you can see here, it doesn't take much effort to chisel away some of the mortar, and in seismic action, this kind of weakness is one of the culprits that leads to collapse of vertical load-carrying ability of the masonry. When we build buildings today, we know and can anticipate a degree of energy absorption that can be expected in an earthquake. A URM, however, has no definable amount of energy absorption ability. So what you find is, as soon as the building takes on energy from an earthquake, you see immediate failures, and walls and other features just fall away. So it needs to be understood that this type of building can't be brought up to code